This is the VOA Special English Health Report. A new study suggests that dental x-rays may increase the risk of the more common kind of brain tumor. However, experts say the risk of these mostly non-cancerous growths is still very small. The study compared about 1,400 patients with a brain tumor called a meningioma to a without brain tumors. Dr. Elizabeth Close of Yale University led the study. She says it found that those with the tumors was about twice as likely to report having had a common kind of X-ray called a bait wing. The clinic was rather with a kind of imaging called a panoramic X-ray. They were up to 5 times the risk, depending on age or how often the X-rays were taken. Dr. Close points out that in the study, the people were generally in their 50s or older. They were asked to remember X-rays they might have had many years earlier, so there is a chance they might have underreported or overreported how many dental X-rays they had. Dr. Close says she does not want to scare people away from dental visits. In her words, the big take-home message is keep going to the dentist, but have a conversation with your dentist about whether you might be able to reduce the number of X-rays that you receive. Her research paper appears in the American Cancer Society's journal, Cancer. During dental procedure, and even when people brush their teeth, mouth bacteria often enter the plaque system. A popular belief is that gum disease can lead to heart attacks. But the American Heart Association recently published a statement saying there is no scientific proof. The statement, appearing in its journal Circulation, says gum disease has not been proven to cause heart disease or stroke. And it says treating gum disease has not been proven to prevent them. There is also not enough evidence to know whether brushing and flossing regularly can prevent heart disease. A committee of heart doctors, dentists, and infectious disease specialists considered 500 journal articles and studies. They said there is not enough evidence at this time to confirm a cause and effect relationship between gum disease and heart disease. Both diseases are often found in the same patient, but the expert says this is possibly because of risk factors common to both diseases. People who do not pay attention to risk factors like smoking, diabetes, or high blood pressure may not pay close attention to their oral health either. For VOA Special English, I'm Caroline. Pursuit.